see bravery from our own members, of course, and often when we least expect it. Some of you will remember 2 years ago when we had the privilege of being addressed by one of the bravest and strongest women I've ever met, Anthea Dennis. Her son Daniel fell to his death in his first week at work. Daniel's parents, with the support of the GMB, their union, fought the Crown Prosecution Service to ensure that their son's employer didn't escape justice. They also campaigned for a new law on corporate manslaughter. And they're still campaigning for greater awareness of the risks that employers take with our workers' safety day in, day out. Despite the pain and the loss and the memory of their son, that never goes away. They still haven't given up, and they're not silent. They haven't forgotten how important trade unions are for our members. I met Anthea and Peter again recently. I met them at Bridgend College in an event to commemorate Workers' Memorial Day on the 28th of April. They unveiled a plaque in Daniel's name and took part in the first proper Wales TUC commemoration of Workers' Memorial Day. I was also pleased to see the Health and Safety Executive there taking part and supporting that day. And that's because the HSE know the truth as much as we do. A trade union organised workplace is a safer workplace. Trade unions don't just improve the lives of our members, we can actually help to save the lives of our members where we're organised. Health and safety activity is an essential core part of our activity as trade unionists. And that's why I'm glad to see that the Wales TUC will hold its first annual Health and Safety Conference this autumn. We should be proud of the work that all of our health and safety reps do. We should celebrate their success and share what each of us does well. Now, accidents at work, whether fatal or serious or minor, are almost always avoidable. The sad truth is that normally it comes down to corner cutting, money, and carelessness. Employers know this, and we know this. We also know that each death is a tragedy for the individual, for their family, and likely for a whole community. But we also know that accidents at work are not the biggest workplace killers. Industrial disease, and more specifically, asbestos, is the single biggest killer of workers in our country. It's already claimed the lives of tens of thousands of workers, and it will go on to claim more lives. Over 4,000 people each year suffer an asbestos-related death. And I do mean suffer. It is a terrible death. Over half of those deaths are mesothelioma sufferers. Mesothelioma is caused by asbestos and always fatal. It is a national scandal. Many people in this hall will know someone who has died from an asbestos-related disease. We need to get away from any misunderstanding that asbestos deaths only affect tradesmen and heavy manual industries. They affect teachers, healthcare workers, cleaners, and sales assistants. They will all keep on suffering. They will all keep on dying. Now, the Association of British Insurers fought successfully to overturn years of compensation awarded to pleural plaque sufferers. At the time, they said they were concerned only about clarifying the law and spending their time and resources on compensating mesothelioma victims. Well, the insurance industry has then, of course, gone on to attack mesothelioma sufferers. The trigger issue litigation is the latest attempt. The Association of British Insurers, though, don't want you to think that they're bad guys. Again, they only want to clarify the law. Malcolm Tarling of the ABI said, "This is not a question of insurers looking to evade their responsibilities. This is a question of obtaining legal clarity. Basically, what is the event that triggers asbestos-related illness? Is it when a person is first exposed to asbestos fibres, or is it the time when the symptoms become apparent?" Well, the key difference is that if a court agrees with the insurers, then you can only recover compensation from an insurer if your former employer is still solvent and trading. We know that employers all paid insurance premiums whilst they were trading. We also know that many employers have now ceased trading. We also know that mesothelioma has a latency period of years, if not decades. The result is that anyone who develops mesothelioma years after finishing work, and many do, will not recover any compensation at all from the insurer if the employer is not trading. That's what will happen if they win. That's a situation facing Unite member Charles O'Farrell's family. His family was awarded £152,000 after his death. Now, Charles' daughter, Maureen Edwards, said, "My dad died a painful death from mesothelioma, and watching him suffer was agonizing for all of us. Excess insurance then poured salt into the wound by forcing us to fight them in the court to receive compensation which we had already been awarded, but they refused to pay. My dad would have been proud that with the backing of his union, we finally achieved justice for him, but he would have been disgusted by the lengths the insurers went to get out of paying." Well, sadly, they're still trying. This isn't about clarifying the law. That's absolute cobblers. And ABI know that just as much as we do. The law was quite clear before the insurance cartel decided to try and change it. And that's the point. They want to change the law. This isn't about legal clarity. This is about money. Lots of money. The insurance industry don't care if workers and their families were negatively exposed to asbestos. They don't care if people die terribly. They care about numbers, statistics, profit. This really is about them and us. Round 2 takes place in the Court of Appeal this November.